What is Narcan and how does it work? Have you ever wondered how a simple medication can save lives during an opioid overdose? Narcan, known as naloxone, is that life-saving medication. It is specifically designed to reverse the effects of opioid overdose. Opioids include substances like heroin, morphine, fentanyl, and even prescription painkillers. When someone overdoses on these drugs, they can experience severe symptoms such as slowed or stopped breathing, unconsciousness, and in some cases, death. So, how does Narcan work? Narcan acts as an opioid antagonist. This means it blocks the opioid receptors in the brain and nervous system. When someone is overdosing, opioids bind to these receptors and cause dangerous effects. Narcan competes with those opioids and attaches to the same receptors. By doing this, it displaces the opioids and stops them from activating the receptors. This process can quickly restore normal breathing and consciousness. The speed of Narcan's effects is impressive. If given intravenously, it can start working within 2 minutes. If injected into the muscle, it takes about 5 minutes. For the nasal spray version, it usually takes around 10 minutes. However, the effects of Narcan last only between 30 to 90 minutes. This means that if the opioid involved is long-acting, multiple doses of Narcan may be necessary. It is important to note that Narcan only works on opioid overdoses. It does not reverse overdoses caused by non-opioid drugs like stimulants or benzodiazepines. For individuals who are dependent on opioids, Narcan can trigger withdrawal symptoms. These symptoms may include agitation, nausea, sweating, and rapid heart rate. Therefore, it is often given in controlled, small doses to minimize discomfort while restoring breathing. From an anthropological standpoint, Narcan plays a vital role in tackling the opioid crisis. This crisis is closely tied to social and economic inequalities. The availability of Narcan in communities facing poverty and marginalization shows efforts to reduce overdose deaths. It provides emergency support in the face of systemic challenges. Emergency responders, healthcare providers, and even everyday people are increasingly using Narcan. This shift reflects a move toward harm reduction strategies that recognize the complex social factors behind opioid addiction and overdose. In essence, Narcan, or naloxone, is a life-saving medication that quickly counters opioid overdose by blocking opioid receptors. Its use is a practical response to the opioid epidemic, especially in vulnerable populations where the risk of overdose is heightened by social and economic disparities.